Hi, I'm Mike Hughes. Welcome to Kaleidoscope Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. My guest today is Dr. Kent Chevli, the president of Western New York Urology Associates and the chair of urology at Millard Fillmore Suburban Hospital. Today, we'll be discussing prostate cancer, detection, as well as available treatment. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Chevli. Thanks for joining us. Today we're talking about prostate cancer detection. So can you tell us a little bit about what prostate cancer is?
Prostate cancer is a cancer that arises in the prostate gland. Prostate gland typically is a walnut-shaped gland, about the size of a walnut, located in the pelvis. Its main purpose is to produce fluid for sperm to swim through and get nutrition from, and for fertility purposes. And as men get older, it can cause a series of other issues, but one of them is cancer, the prostate.
So what is the prevalence of prostate cancer, and who's at risk?
Prostate cancer is the most common cancer in men. It's the second leading cause of cancer death in men. About 1 out of 9 men will develop prostate cancer. If you look at just the African American population, about 1 out of 6 of those men will develop that cancer. And frankly, it's more aggressive typically in that population.
Sure. So here at Suburban Hospital, yourself, your partners with Western New York, you've been treating prostate cancer for a long time. Tell us a little bit about your background and how you became specialized in this line of care.
That's a great question. As a urologist, all of us get trained in urologic cancers. Urologic cancers are about 25% of all cancers that are diagnosed are urologic. Main reason is prostate, bladder, and kidney cancers are in the top 10 of all cancers. So most people are surprised to find that urologists take care of so much cancer, and being that, it is an incredibly important part of our training. Within Western New York Urology Associates, we have about 24 urologists. We have 4 radiation oncologists. Because cancer care is such an important part of it, we've made that a commitment for us as an organization to provide the state-of-the-art, best care possible for our friends, family, and the community.
Prostate cancer isn't your most well-known cancer. There may be a little bit stigma to it because it is really male-oriented. How is it detected, and what do you tell patients when they may be going through something like this?
Yeah, prostate cancer, you're right. Obviously, men get prostate cancer, and men, generally speaking, are not as good about taking care of their health as a lot of the women. And that's unfortunate because a lot of health issues can be treated much better with less complications and less side effects if caught early. Now, prostate cancer, by and large, is fairly silent unless it becomes advanced. The recommendation is to identify if you have prostate cancer. Men over the age of 55, between 55 and 70, should have an annual examination by their primary doctor or urologist, which includes a digital rectal exam and a blood test, a PSA. Now, that's a pretty broad range of 55 to 69. If you want to narrow it down, those patients who are African American or who have a family history, they ought to actually start at a younger age, maybe even as young as 40, and to make sure that they don't develop that cancer.
Sure. You mentioned PSA, so for the viewers out there, can you explain what that is and what PSA stands for?
So PSA is a blood test, stands for prostate-specific antigen. It is a test that's been around for decades, and there's been some controversies about the utility of the PSA, but there is no question the PSA will identify prostate cancer better than any other blood test that's available. Although it's not perfect, it is the best we have.
Sure. So the PSA becomes your most reliable tool in terms of detection. What are the pros and cons? So if there is some controversy, what are the pros and cons there?
The pro, of course, is PSA can help us identify prostate cancer, but the con really is a lot of those men who we identify prostate cancer don't need to be identified. In other words, they will not be harmed by the cancer.
Sure.
Many prostate cancers are very slow growing, don't need to be treated, or should not be treated. So we really, one of the criteria we use when whether or not a patient should even be tested for it is whether or not we think the patient has a longevity of life ahead of him. Those patients who have a lot of other problems, heart disease, uncontrolled diabetes, breathing issues, where we have a lot of other conditions which may limit their lifespan, prostate cancer is probably not as important to find.
Right.
But those men who are young, are healthy, and I don't even like to look at it as an age, but young by feel. There's plenty of men who are in their 70s and 80s who are in excellent health. So you have to look at the individual. But the controversy is you should not identify or treat patients for prostate cancer if we don't think they have longevity in life.
So as you go through and the awareness becomes a little bit higher in terms of prostate cancer, and men are dealing with this issue, why is Prostate Cancer Awareness Month important in terms of education? Because we talked a little bit earlier about the stigma. Why is Prostate Cancer Month important?
I think you're right. There is a stigma around prostate cancer. Men don't like to think about things like that, and I think if you don't have a month like September is, people forget about it. If you have it spread throughout the year, it doesn't have the focus on the individual. And of course, September often is thought of as a month that the football season is starting, or the baseball season is coming to the excitement stages. So people are more likely, men are awake and alert at looking at television and more likely to notice the marketing that revolves around that cancer. And I think it's really important to shine that light to those men.
Right. At Suburban Hospital, your partners, yourself, you've treated thousands and thousands of patients over the years. Can you tell us a little bit about the advancements that you've seen in prostate cancer?
For sure. There's advances in both the identification of prostate cancer, in other words, finding those men with significant prostate cancer, and the treatment side. In the identification side of it, we have gone well past just the PSA, which we still value very much. There are urinary markers that we have been using to identify special gene mutations that can be a sign of prostate cancer. That urinary marker, it's called PCA3. We've been using that for many years. Another test that we found very useful and probably the most revolutionary is MRIs of the prostate. And it's a special type of MRI called a multiparametric MRI. We were among the first in the region to start using it, and we have the most experience by far in the state of New York in utilizing that technology. And main part of this is you having not just the equipment and the technology, but the radiologists who know how to interpret it. We've partnered with Great Lakes Medical Imaging. The physicians there are outstanding, and that is so critical in identification of appropriate areas on the MRI. And then once that's identified by the MRI, then we perform a special type of biopsy of the prostate called the fusion biopsy. Another thing we're very proud of, we were among the first in the state actually to be utilizing the technology to do that. We are able to biopsy the area that's identified on MRI with pinpoint accuracy, not just the whole area of the prostate where you can easily miss if you just do random biopsies. And the important part of all this is we're able to identify the more aggressive cancers, not just those slow-growing ones which may not cause harm. We're able to more likely identify those that are going to grow faster and cause more problems for the patient.
Sure. So we've talked a lot about identification and signs and markers and things like that. Tell us about the treatment of prostate cancer and what that entails.
So when we identify patients with prostate cancer, there's really three primary ways we go with the treatment. One is active surveillance. Those are patients who we select. We may have a low, slow-growing cancer, a low-volume cancer, which we may not cause a harm to the patient. And then in those cases, we would monitor them with MRIs on a regular basis, PSAs on a regular basis, and periodically may have to do a biopsy, but without actually treating the cancer because it is so slow and may not cause a problem at all. The second way is robotic surgery, where we go in with robotic instruments. It's a laparoscopic form of surgery. We have specialists within our group that do that and have done it thousands of times. And the patients recover quicker, have less complications. And third, very important way, is a special form of radiation therapy called IMRT. It stands for Intensity Modulated Radiation Therapy. And it's another non-invasive way of treating the cancer with X-ray treatments, with radiation treatments. We can hit the prostate with laser precision and cause less side effects because of that.
Sure. So if someone has a fear that they may be at risk, they may think that they have some issues, their physician may have said that they're at risk as well. What do you tell patients? What advice do you have for them? How should they move forward when dealing with an issue like this?
When a patient presents to us with let's say with an elevated blood test, a PSA is abnormal, or the primary doctor finds a nodule, one of the first things we tell the patient, we have to assess whether or not they're candidates for evaluation. Just like I said before, we have to make sure they have other health issues are fine. And we do something called shared decision making. We educate the patient in identifying what are the risks and benefits of doing an evaluation. And that includes checking for other problems like urinary tract infections and enlargement of the prostate, which can cause problems with their urination. But we would then need to do a biopsy of the prostate. The biopsy of the prostate is done in the office. It takes about 10 minutes to do. It is not nearly as morbid as many people think it is. And then once we do the biopsy, then of course now we have the data to say whether or not we need to do anything further.
Sure. Dr. Chevli, thanks for joining us today. There's been an awful lot of advancement. You guys have done tremendous work taking care of our patients here at Suburban Hospital, as well as through your partners at West New York. So thanks for joining me today.
Thank you.
I appreciate it. I'm Mike Hughes. We'll see you next time on Medically Speaking.